Before exploring the powerful benefits of DHA-rich fish for fetal brain development, it is critically important to address a serious and often underestimated seafood hazard: ciguatera poisoning. This toxin-related illness, unlike common foodborne infections, cannot be smelled, tasted, or eliminated through cooking, freezing, smoking, or marinating. Ciguatoxin is produced by marine microorganisms, Gambierdiscus species, that grow on coral reefs in tropical and subtropical waters. Small herbivorous reef fish ingest these microalgae, larger fish eat them, and the toxin becomes increasingly concentrated up the food chain. The highest risk species are large reef predators such as barracuda, grouper, amberjack, snapper, and moray eel. People living in or visiting coastal regions of the Caribbean, Hawaii, the South Pacific, Southeast Asia, and Indian Ocean islands are particularly exposed, and outbreaks continue to rise due to climate-related coral reef changes and commercial seafood distribution that transports risky fish far from their natural habitat. Ciguatoxin attacks the nervous system and gastrointestinal tract, and symptoms can appear between 30 minutes and 12 hours after eating contaminated fish. Patients often experience intense nausea, vomiting, abdominal pain, diarrhea, and severe dehydration, followed by neurological effects that may include tingling or numbness in the hands and feet, muscle weakness, dizziness, temperature sensation reversal, a hallmark symptom where cold objects feel burning hot and warm water feels icy, metallic taste, itching, and difficulty walking or coordinating movement. Some people develop long-lasting effects that persist for weeks or months, including chronic fatigue, depression, sleep disturbance, and hypersensitivity to alcohol or caffeine. There is no cure, no specific antidote, and no laboratory test widely available to screen fish before consumption. A treatment is supportive only, managing symptoms, hydration, and sometimes IV therapy for severe reactions. Because the toxin remains stable even at high cooking temperatures and is unaffected by lime, vinegar, or spices, culinary preparation methods that protect against parasites or bacteria offer no protection from ciguatera. Pregnant individuals, children, and those traveling to tropical regions should be particularly cautious, as exposure during pregnancy can increase complications and intensify neurological effects. Since even tiny quantities of ciguatoxin can trigger illness, avoiding high-risk reef predators is the safest approach. Seafood safety agencies advise choosing smaller reef fish when dining in tropical destinations, avoiding barracuda entirely, and consulting regional advisories or local fishing guidelines before consumption. Travelers who fish on guided excursions should ask specifically about species risk and avoid eating large carnivorous reef fish on site. If symptoms appear after consuming reef fish, immediate medical evaluation is essential, especially if neurological changes occur. Once these risks are clearly understood and controlled, it becomes possible to appreciate the remarkable benefits of safe, low-mercury, cold water fish for pregnancy and early brain development. DHA, docosahexaenoic acid, a major structural omega-3 fat found abundant in small oily fish such as salmon, sardines, anchovies, trout, and herring, plays a central role in forming the fetal brain, retina, and nervous system. Up to 40% of the brain's polyunsaturated fatty acids, and over 50% of those in the retina, are DHA. During the third trimester and the first 2 years after birth, the fetal and infant brain grows rapidly, requiring a constant supply of DHA transferred from the mother. Research shows that pregnant individuals who consume adequate DHA have children with improved visual development, stronger cognitive performance, better attention and memory, and possibly reduced risk of developmental delays. DHA also supports healthy birth weight, longer gestation, and lower risk of premature delivery. For pregnant women who may avoid fish due to toxin concerns, nutrition experts emphasize that avoiding all seafood is not the solution. Instead, choosing the right species is key. Cold water omega-3 sources such as salmon, sardines, anchovies, trout, mackerel, Atlantic, not king mackerel, and pollock are among the safest and most beneficial options with very low toxin risk and minimal mercury exposure. Major health organizations, including the FDA, EPA, American College of Obstetricians and Gynecologists, and WHO, recommend eating 2 to 3 servings, 225-340 g, per week of low-mercury, DHA-rich fish during pregnancy to optimize fetal neurodevelopment. Many DHA supplements exist, but research consistently demonstrates that whole food fish provides broader nutritional advantages due to synergistic minerals like iodine, selenium, choline, and vitamin D. The key message is empowerment through informed choice. Fish can be one of the most powerful prenatal foods, but smart selection and awareness of regional toxin risks are essential. By avoiding large reef predators, consulting local seafood advisories when traveling, and prioritizing safe, small, oily fish, expectant parents can confidently gain the profound brain-building benefits of DHA while minimizing avoidable dangers. Knowledge, not fear, protects both mother and child. And when decisions are guided by science rather than uncertainty, fish becomes not only a delicious meal but an investment in the lifelong cognitive and neurological health of the next generation.